Founded with a mission to broaden public awareness on the importance of global health, while honoring the men and women who dedicate their lives to improving the health and well-being of the world's most vulnerable. The Virchow Prize for Global Health is the first international and prestigious award which covers the wide spectrum of global health engagement, upholding the legacy of Rudolf Virchow. Join the global health community, distinguished guests, and keynote speakers for a special ceremony in Berlin, recognizing the first Virchow Prize for Global Health laureates, celebrating their dedication towards achieving health for all and the United Nations Sustainable Development Goals.
Welcome, ladies and gentlemen, to the press conference of the Virchow Foundation for Global Health to announce for the first time the Virchow Prize for Global Health. I'm very happy to see you all, and we'll first present the Virchow Prize, and then there will be possibility for questions and hopefully answers. I'm sitting here with the president of the Virchow Foundation, Professor Gerald Haug, and member of the Board of Trustees of the Virchow Foundation, Roland Göde. And Roland, I suggest you introduce the Virchow Foundation.
Thank you so much. We are honored to welcome you to the announcement of this first awarding of the Virchow Prize for Global Health under the high patronage of German Federal President Frank-Walter Steinmeier. The Virchow Prize for Global Health is granted as international highly prestigious award by the Virchow Foundation for Global Health, a non-profit foundation established through the support of the German National Academy of Sciences Leopoldina and the Berlin Brandenburg Academy of Sciences and Humanities, alongside civil society and leading experts within global health. The Virchow Foundation for Global Health was established with a clear mission to anchor and broaden public awareness on the importance of global health towards mobilizing the attainment of the United Nations 2030 Agenda Sustainable Development Goals, the so-called UN SDGs. A key pillar of this mission is upheld through the awarding of the Virchow Prize for Global Health. Laureates represent the Foundation's founding mission to the core. The award specifically recognizes and honors laureates having demonstrated overcoming complexity and navigating the interrelationships between medical, politic, economic and social determinants. The Virchow Prize for Global Health is the first prestigious award of its kind which recognizes and celebrates groundbreaking contributions and innovations as well as lifetime achievements across the broad field of global health, upholding the UN SDGs. Those who work tirelessly towards improving global health through lifetime achievements deserve recognition at the highest level for their efforts towards achieving health for all. On behalf of the founders, we are deeply honored and humbled by the commitment of the members of the Virchow Prize Committee and the Foundation's Council and Board of Trustees. All in all, 45 internationally experts with highest profile and exceptional track record from all over the world. Without the honorary contributions of these outstanding personalities, establishing this groundbreaking new, much needed and already since long time desired prize would not have been possible.
Thank you very much, Roland, for this introduction of the new Virchow Foundation for Global Health. And now, Gerald, today is September 12, 2022. This is the day where the first recipient of the Virchow Prize for Global Health is being announced. And this is your duty and your privilege as president of the Virchow Foundation. Please.
Thank you, Detlef. Ladies and gentlemen, as the president of the Virchow Foundation for Global Health and the chair of the Virchow Prize Committee, it is my great privilege to announce today that the Virchow Prize for Global Health 2022 is being bestowed upon Dr. John Kengasong, for his outstanding lifetime contributions towards strengthening global health. Dr. John Kengasong has been born in Cameroon and started his impeccable and very impressive academic career at the University of Yaoundé, studying virology. Dr. Kengasong has obtained his master's degree in tropical biomedical sciences and in medical and pharmaceutical sciences at the Institute of Tropical Medicine in Antwerp, and holds a doctorate in medical sciences and virology from the University of Brussels. His research group was the first to characterize all of the genetic subtypes of HIV in Africa. Continuing his outstanding contributions to understanding infectious diseases, he researched on the diagnosis, pathogenesis, and drug resistance of HIV, AIDS as Chief of Virology at the World Health Organization. Dr. Kengasong then joined the United States Center for Disease Control and Prevention in Atlanta, United States. Assigned to Abidjan, Ivory Coast, under his leadership, the team created one of the first laboratories on the continent capable of precisely measuring HIV in the blood and sequencing the virus. In 2011, Dr. Kengasong played a crucial role in establishing the African Society for Laboratory Medicine, a Pan-African organization strengthening laboratory networks and systems in Africa, as well as lending strong support and development opportunities to African researchers. In 2016, John Kengasong significantly contributed to establish the African Center for Disease Control and Prevention as founding director. Under his leadership, the African CDC established strong cooperation between the African Union member countries to tackle future health threats. The organization became more independent and currently employs beyond 200 experts, raising significant funds to fulfill its important mission. During the COVID-19 pandemic, Dr. Kengasong continued to coordinate the continent's response and was appointed a special envoy to the Director General of the World Health Organization on COVID-19 preparedness and response. In June 2022, Dr. John Kengasong was appointed the US Global AIDS Coordinator and Special Representative for Global Health Diplomacy of the United States. As the first Director of African origin, Ambassador Kengasong is leading, managing, and overseeing the US President's Emergency Plan for AIDS Relief, PEPFAR. The utmost impressive and outstanding role which Dr. Kengasong has assumed since his earliest academic and political beginnings in science, research, the establishment of crucial global health institutions, and in educating and training new generations of global health scientists, activists, and diplomats, led to the unanimous decision of the Virchow Prize Committee bestowing the first Virchow Prize for Global Health, the prize here in 2022, upon John. Dr. John Kengasong has made exceptional contributions to improve global health through scientific, societal, and political innovations. He was one of the key personalities in establishing the global health dynamics and infrastructure in the Global South. During his time as director of the Africa CDC, he implemented and developed health-improving governance and cooperation, improving health and individual well-being at a global scale. Addressing complex and diverse global health challenges, Dr. Gengasong, from early on in his life, acknowledged the immense importance of worldwide cooperation and the necessity for systematic and holistic approaches, efficiently and effectively bridging global South and global North with his unparalleled commitment. He has an exceptional track record for nurturing and supporting the younger scientific community, providing them mentorship, guidance, support, and exposure. Before and during the COVID-19 pandemic, he remains a significantly strong, essential, and widely recognized voice in addressing systemic and health inequalities, including gender inequalities, and calling for greater and more equitable access to vaccines. This has also contributed to increasing prevention of infectious diseases and improving community health. The Virchow Prize Committee is convinced that for his lifetime influence and achievements on the attainment of the Sustainable Development Goal number 3, good health and well-being for all, as well for its intersectionality with other goals of the United Nations 2030 Agenda, the Sustainable Development Goals, as well as Sustainable Goal 17, partnerships for the goals, Dr. John Gengasong deserved being honored with the Virchow Prize for Global Health. The Virchow Prize Committee and the Virchow Foundation for Global Health cordially congratulates Dr. John Gengasong for the bestowment of the first Virchow Prize for Global Health. John, congratulations.
Thank you very much, Gerald. Ladies and gentlemen, that's the prize winner of the 2022 Rudolf Virchow Prize for Global Health. And of course, we are open for questions, but let me add one very personal note. I think Rudolf Virchow would have been happy after 200 years. Rudolf Virchow was born in 1821, so it's almost exactly 200 years after Rudolf Virchow's birthday that we have the Rudolf Virchow Prize. And I'm sure, I did not know Rudolf Virchow personally, of course, but he would have been happy to have John Gengasong as the prize winner and the first prize winner. Why? Rudolf Virchow was a scientist, and at his time, 1850 and so on, used the most modern sciences. At that time, optics. At that time, biochemistry. And various other techniques jointly with other colleagues to establish the Berlin School of Medicine, which was one of the leading schools at his time introducing basic sciences into medicine. Before, medicine was more of an experience type of science and trying to help people, which frequently was not possible. But Rudolf Virchow, in addition to being a scientist, he was a person who coined the famous phrase, medicine should be a social science and politics should be nothing else but medicine at a large scale. So Rudolf Virchow was seeing the social responsibility and the need to include not just science and academia and medical doctors, but also politics, civil society, and also the private sector if you want to achieve global health. And if you look at John Gengasong, that's exactly what he did. He studied virology, he was a scientist, or he is a scientist, fortunately, very much alive and still very influential. And at the same time, he sees the responsibility, especially at the time of pandemics, that the science really has to be brought to the people and try to help with science improve global health at a large scale. That is social responsibility. And also, John, as Gerald mentioned, went into politics, and he assumed and he accepted, I must say, accepted jobs which are in a way political jobs, but bridging science and civil society and private sector to improve what we all need and want to be done, improve global health. So I think it's wonderful that the first prize winner for the Virchow Prize really has been found by the search committee and by the prize committee, the Virchow Prize committee, and they identified John Kengasong as the person who really exemplifies what we want to do with the Virchow Foundation for Global Health. And in other words, perhaps also as a person who, after German reunification, came to Berlin. Germany has had a difficult history, and Germany has seen, and especially Berlin has seen, that you have to, in addition to kind of pursue your own goals, you have to find partners for the big goal, including improving global health and improving by humanitarian multilateral interactions the state of the world. And we are very happy to state here that the city of Berlin, the mayor of Berlin, governing mayor of Berlin, and also the, as has been mentioned by Roland already, the German parliament and also the president of the Federal Republic are supporting this. So in a way, Germany, in a way, pays back. On the example of Rudolf Virchow, what the world needs, support of the Sustainable Development Goals, and number 3 is better health for all and well-being for all. Thank you very much. And now this announcement of the Virchow Prize is open for discussion.